Welcome to the Davies Use Case webinar being presented by Hospital for Special Surgery on optimizing consumer access. This is a Davies award-winning use case for the value of health IT. My name is Arnold Simmons. I'm the Manager of Quality and Patient Safety at HIMSS, and it's my pleasure to moderate this presentation. Core to the HIMSS mission is promoting the use of health information and technology to improve the quality of healthcare delivery. HIMSS promotes and advocates the integration of clinical decision support, best practice guidance, access to clinical data to analyze progress, information and technology enable patient safety tools for all healthcare organizations, clinicians, patients, and community members as vehicle for improving patient outcomes. The HIMSS Nicholas C. Davies Award of Excellence is the pinnacle of the HIMSS Value Recognition Program. Davies Award recognizes outstanding achievement of organizations from around the world who have utilized health information and technology to improve patient outcomes and value. Davies Award-winning use cases have been peer-reviewed to validate sustainable, improved patient and business outcomes resulting from health information and technology-enabled care delivery. So it's my pleasure to welcome our speaker for today's webinar, Andy Kaladny. Andy, I will turn this presentation over to you.
Thank you, Arnold. My name is Andy Kaladny. I am the Director of Physician Referral Service, and I'm very excited to speak with you today about the case study for optimizing consumer access with technology improvement for the Physician Referral Department. I'm going to take you through an introduction, an overview summary, a little bit about Physician Referral Service, discuss the problem, as well as the way we approach the objective and solution, and the planning and implementation, as well as going over results and lessons learned. Just a quick introduction about myself. I've been at Hospital for Special Surgery for about 8 years, in the Physician Referral Department for about 4. Prior to that, I was in the Service Excellence Department, where on the day of surgery, we would manage patients and families prior to heading into surgery and then throughout their day. Never at that time was it more important to realize how important the match between the patient and the physician is for the patient as well as for their loved ones who are going to be supporting the patient during surgery. And I've taken that to the Physician Referral Department in speaking about matching physicians with patients in the right time, at the right place, most efficiently. So HSS is in the enviable position where we have thousands of patients with many different preferences who want to come to HSS from all over the world, and they seek our care in many different ways via phone, email, and they want to see many of our highly specialized physicians in the location where they live, and it is our job to connect patients with these physicians in a seamless and an efficient way. We believe that improved patient outcomes begin with optimized and fast access. We needed a scalable and an efficient process to provide a better experience for consumers, and we sought out a technology solution to enable us to deliver a standard of service to which consumers have been accustomed, like with Amazon Prime or the travel industry. To meet the patient needs, HSS identified 3 guiding objectives. That was to provide the right level of care in the right place at the right time most efficiently, to provide the highest level of patient experience from first points of contact through treatment and recovery, and to optimize the physician's schedule's capacity. Physician Referral Service is made up of 12 staff members. We receive thousands of inquiries each week, which come in via email, phone, and it is our job to disseminate these requests to over 200 very highly specialized physicians at the right level of care, whether it's for a non-surgical evaluation or for surgery. And our challenge is to identify a scalable approach to a specialist through fast access and just a seamless experience for the patient. So when we match patients with providers, there are many, many preferences on the side of the patient, as well as what the physician has in his scope of practice. There's thousands of permutations, and what's right for one patient is not necessarily right for the next patient. And so if you take these myriad of preferences and the scopes of practices from our physicians, if we drew lines between all of these options of opportunities to match the right patient with the right physician, it would be endless. And so we sought out a technology approach that would do all of this in the system for us so that it would be quick and seamless and easy. The problem with our legacy system was the workflow was inefficient and redundant. If you look at the pictures at the bottom of the page, it really depicts the way we felt as we were trying to navigate patient inquiries on the phone, and navigating a system that is not smooth and seamless is just time-consuming. Length of call times were elevated, and the legacy system for matching consumers with physicians was inadequate to scale in support of its strategic expansions that were happening at HSS, specifically with location searches. Several of our physicians were going into regional locations closer to where patients lived, and we wanted to make that convenience part of the experience. When patients called us for a physician, we wanted to offer that, and the legacy system did not allow us to filter on physicians by locations, as well as some other expansions that were happening at HSS. The legacy system was also very difficult to maintain. We needed to maintain physician profiles ourselves. We needed to utilize our own IT department, the vendor IT department, and changes were not made in real time. And this took away from the accuracy of referrals when a physician needed to change their scope of practice, or if there was a new strategy in place, upgrading the system to that level took weeks. We also were looking for physician referral analytics to provide trust and value to our physicians. In the legacy system, the physician referral analytics was substandard as a weekly data drop to an Excel spreadsheet. While it was nice having the data, the picture of the gentleman on the lower right-hand side of the screen really depicts the way I felt very often at dinner time, trying to run data and put it in a presentable format for physicians on an ongoing basis. To give you an idea of the navigation challenges, this is an example of a cartilage inquiry, somebody who had a cartilage issue seeking a surgical consultation. And what it shows is in the upper left-hand corner, we would click on the chief complaint. We would then have to look down and pick the condition alphabetized into one of these buckets. And so a typical bucket we would pick is injury and the letter A through K, because C falls in the middle of that. If you go to the lower square on the left-hand side, you can see that injury condition cartilage is selected, but right below that it says injury condition cartilage NS for non-surgical. If we selected the wrong option, different physicians would come back, and that would create us having to go back and redo the search. Once we got past the condition and we selected the correct condition, we would then want to filter on insurances, which were also listed alphabetically. And as you know, there are many, many options of insurances, and so scrolling through an alphabetized list was cumbersome. We would then get the physician results and then provide that information to the patients. There was no opportunity to email the information. We had to create our own templates. So one of the things we did when we were seeking a new system, one of the things we did was to survey our internal users and stakeholders to find out what would be best from the level of the staff using the system, ways to improve it. So we came up with current use of the current system and put down some criteria of what success would look like. And then we asked the users to give a score out from 1 to 10 in each of these areas and where they felt we could improve. And so for ease of use, match to provider, match to location, distance, surgical status, match to physicians in participating strategic initiatives, maintenance of physician profiles, EPIC integration, MRN tracking of patients, the integration with insurance participation, integration with physician practice management files for office manager names, availability of data and real-time data dashboard. And as you can see, we were scoring anywhere between 0, not much more than 5 or 6, and the data availability was a little bit better, but we knew we had a lot of work to do to improve the system and the process. So in seeking a solution, we looked to address some guiding objectives and to create value. One of the things I want to point out is that physician referral service is an optional service for patients and for physicians. Physicians do not need to participate in our panel, and patients can seek a referral or care through the website. They can ask friends, they can Google search, and so we wanted to provide a value that when you call Physician Referral Service, you receive the information in an easy way with confidence, and that you felt that confidence in the physician that you were matched to. So we look to address a few things: the patient experience, referral accuracy, physician engagement, and the operations in Physician Referral Service. So in seeking patient experience, to provide a best-in-class experience for patients, we wanted the ability to search and filter for our providers based on patient preferences. It was very important that the more patient preferences we could filter on, the closer the match would be to the physician that was right for that particular patient. We also wanted a CRM tool so that if a patient called us for the first time or repeatedly, we had a way to track the referral as well as to engage the patient in a meaningful conversation if they had reached out to us in the past, that we could either speak about the great experience they had, or if it was just a few days ago and they were calling back, to find out what we could do to improve the experience and the process that suited them best. Looking at referral accuracy, we looked at an extensive library of clinical concepts that was separate from surgical and non-surgical alignment. That meaning that an ACL tear would be an ACL tear whether it was for surgical or non-surgical. So the filter of surgical and non-surgical needed to be separated from the many myriads of thousands of conditions and treatments that were out there. We also needed smart search functionality for conditions that were difficult to spell and pronounce. One example is ankylosing spondylitis, which comes up quite a bit, and the staff gets a little stymied on that search. So we type in 3 letters, A-N-K, and the rest of it would drop down, just like they have in Google search. We also wanted the ability to search on regional locations, and we wanted to be able to maintain profiles, physician profiles in real time to maintain the referral accuracy, because once a physician changes something in their profile, it's very important to get that information updated immediately so that referrals can continue on effectively taking those changes into consideration in real time. With physician engagement, which was a very important piece of what we wanted to achieve with implementation of a new system, we needed to standardize reporting to physicians. We needed to build trust and to provide transparency so that they, in their own time, could look at their referral volume, and we could have all of the physicians having access to their referral volume, not just the physicians who would call us, because to provide reports to over 200 physicians every month, every week in real time just was not something that was attainable. We also wanted to empower physicians to measure and modify their scopes of practice in real time. So looking over their dashboard of analytics, our hope was that they would be more engaged and they would converse more about changes on how to increase their referrals or to drill them down or make them more specific to their own utilization so that they could treat at the highest level of their license if their practice was very robust and filled. Then they didn't need patients who were going to overflow their practice. We also wanted additional filters to scale with physician participation in strategic initiatives such as our bundle and employer programs. Looking at physician referral service operations, we were seeking a solution that was user-friendly, that would have the smart search, which made it easier for our staff. We also wanted templates for emails so that when we were providing a referral, we could send out an email while on the phone with the patient with the physician's information, their address, their phone number, anything they may need. We did notice that we do get patients who call us seeking the same information we had provided to them a day or two ago, and that's where that CRM tool also came into great importance. And so we found that sending an email directly after or during the call made a big difference. And then we wanted the metrics not only for the physicians, but also for the access centers so that we could measure productivity and have that information in real time as the staff was utilizing the system, that it would be capturing that data. What I'd like to show you is the solution, and the solution we chose was Kairos Provider Match. And I'm going to speak a little bit now about the implementation and the rollout. So as with HSS, with anything that we do on a broad scale that's cross-departmental, it always goes to governance and steering. And what we did was we made sure that we had multiple work groups set up with very interdisciplinary departments so that we had guidance, our vision was agreed upon, we could look at the technical strategy, and also speak about the clinical best practices. We pulled in high-level directors and specialists and the chief marketing officer, the chief medical information officer, our operational excellence leaders, our IT leaders, as well as having some oversight from our surgeon-in-chief, our service chiefs on our service lines, and clinical quality champion physicians who really helped look at the project and helped us speak it through so that we knew we were on the right track and taking everything into consideration for all of the internal stakeholders that would ultimately provide the best outcome for our patients. So this is just an example of going through the planning phase, the configure phase, and then converting and optimizing. So just a real detailed dive into each area, from the clinical leadership structure to defining the scope of the project, standardizing definitions for configuration and matching, developing an oversight process, which is very important. I want to highlight the communication that we had to the physicians when we rolled out the new system. We set up a very detailed communication plan, and that included many levels of physicians from our surgeon-in-chief all the way down through our service chiefs, physicians, into physician practice management, and even into our office managers, which I'll speak about a little bit later. We also spent a lot of time working out the scopes of practice for each of our service lines and how we were going to configure those so that the physicians would receive the best matched patients to their scopes. We also needed to validate the clinical coverage and referral rules, and then spoke about how we were going to get the information out to physicians through analytics, and also maintaining and managing the profiles of the physicians. So all of this took months and of very detailed planning, which ultimately served us very well. This is the workflow mapping that PRS works off of. So we put together a detailed flow chart of what we expected and where the information needed to come from. And the turquoise blue is where we needed to use the referral tool that we chose, Kairos. The green is utilizing our EMR, and then the blank areas are our workflows that tie everything together. This slide speaks about the system integrations that we have and where the information comes from that consistently keeps the referral tool very much updated. And this was done very systematically, looking at where all the information was stored and how it was going to come into the Kairos Provider Match tool. One of the improvements was that we were able to get our insurance integrated with Kairos so that every night there's a nightly feed, a SQL extract that comes in. So as physicians go from pending insurances to participating, especially our newer physicians, there's very little we have to do. All of a sudden, they'll be showing up in rotation, and that is very helpful. That used to take us about a week. Once a physician told us that their insurances were updated, we would need to check it with our PHO department, make some manual changes, send the inquiries over to our IT department as well as the vendor, where the system had to be updated, and the week that we would lose in providing those referrals hurt the patients and also the physicians. We get a real-time EDT feed from our EMR system, keeping the information very much updated, as well as a monthly update of all of the physician practice managers in the hospital are now being fed into our system, and that's very helpful when we're connecting calls to physician offices. So I'd like to show you a scenario, herniated disc surgical, with our solution tool that we chose. So this is the CRM tool that I spoke about. Patients will call us. If they've come through Physician Referral Service in the past, they will have some cases logged on the side. If they did not, we would still have their information from the feed from Epic if they had been in the hospital before. Otherwise, we would do a mini register on them. Here we can see this patient called approximately a month ago about rheumatoid arthritis with the insurance of Aetna. And so now the patient is calling for a herniated disc, and so we could choose to speak about the prior referral or not, just depending on how engaged the patient is with us in the conversation. So this is an example where we typed in herniated disc, and the first few letters provided the drop-down, and we were able to select herniated disc, select the insurance from a drop-down, and just click on, type in the AE, and the insurance pops up, as well as select surgical as one of the criteria versus non-surgical. So this is a patient who was seeking a surgical consult for herniated disc. This is how the system results our physicians. So patients, physicians that are relevant to the search come up. It's nice having their pictures. It gives us a lot of information. We can also view their profiles to get more information. And then in the situation, the patient asks that they would like to see a physician out on Long Island. And so we did an extra search on location, and it switched up the order of the physicians who treat in that area so that we can do a directed referral specifically to physicians who treat the condition as well as in the location. The next scenario I'd like to go through is speaking about knee pain, non-surgical, and the reason for this is because we also wanted a way to help our staff along if there were any new strategies going on, and this is for a knee pain center that was started. So we wanted to remind our staff that when they type knee pain into the system, they would get an alert where they would be told what to do. So reminding them that we do have a knee pain center on Fridays, that it's for all knee pain, but if a patient has Cigna, we would need to direct access them to physical therapy only if they wanted to come in to see somebody immediately. And in this case, the nurse practitioner who's in the knee pain center is Krista Setna, and as you can see, we can directly book into her schedule. Typically below that would also be physicians, and so if patients preferred not to utilize the knee pain center, it wasn't a problem. We just continue on with the referral and providing our physician names. We wanted to continue to track information, and so one of the things we were looking at was for a referral resolution was if the call came in via call or email, are those converting into referrals and appointments better? Which body part the patient was calling about? So in this case, it was their knee. And what was the outcome of the call? Was it a referral only? In this case, we held the appointment and we scheduled the appointment with Krista Sedna in the knee pain center. All of that would be tracked. And then as I spoke about before, there's also a template, an email template that's set up in the system that we have requested and mapped out for Kairos, which allows the physician name to auto-populate right into the template. And so while we're on the phone with the patient and they've agreed that they want to see Krista Setna in the knee pain center that same week, we were able to send the information directly to the patient while on the phone with them, and this way they had all the information down. They didn't have to write it all down, and this also saves time while on the phone with patients. So one of the other solutions that I want to share with you was coming up with the analytics dashboard for our physicians, and this was a huge improvement that we needed in order to select the vendor that we were selecting. Was we needed to know that they could provide analytics to us in a way that we could share with physicians. So this is the example of the physician analytics dashboard that just gets captured with all of the clicks that the physician referral reps are doing in the system. This is auto-populated, and so the physicians can dial into their individual dashboards 24/7. It's a web-based access, and they can look at their referrals as often as they want, and they can call Physician Referral Service, me in particular, to speak about their referral volume. And there's many aspects of this. We can show them the number of times we gave out their name, what percent of the service line each of them were getting, their payer mix, as well as the conditions that were referred to them. And then any other information they want beyond this information, we can do deeper dives into the data and discuss it, but it really helps to build trust and value. We also wanted an analytics dashboard to provide to our service line directors, and those are our administrators who oversee each of the physician service lines, such as spine or hip and knee, or hand, or foot. Our physicians, as I mentioned, are very highly specialized, and our service lines are broken out by different body parts. And this is an example of an administrative dashboard where they can see how many patients had called during this time frame, how often we gave out their physician names. It's showing the last 6 months, as well as the payer mix for their particular service line, the payer mix over the last 6 months, as well as an individual breakout of physician referrals below that, so that if the administrators have any questions, they can call up or look it up and get answers as far as how the physicians are managing with their referrals, and then we can talk about conversions to appointments, and really talk about breaking down barriers to create access for our patients. The other thing is this is an example of having administrator access in real time. And so if a physician calls up and says, I'm looking to increase my referrals, I do have more capacity, we look at the scope of practice, we can update the scope of practice in real time, and then that can help with it as well. We can also look at the number of insurance that the physician is participating in, and then that would come in through our PHO department if they decide to make any changes over there. But it does allow for referral accuracy, being able to expand and decrease a physician's scope of practice in real time is extremely helpful. We also wanted, as I mentioned, the analytics tied to our call center. And this just gives us an idea of how the staff is doing in real time, the number of closed cases, the number of searches that were needed for each, on average, for each case, and then number of filters that were used in order to secure the patient with the right physician. And then down below, you can see all of our representatives, and we can look at productivity, the number of closed cases, and based on the workflows that they're working on, whether it be emails or phone calls, or as the number of searches in order to close a case. So in this instance, I can see that my first representative under searches closed case is a newer person who needed to do more searches and more filters to get to the right doctor. And then that lets me know that that person would need a little bit more training, because you can see the rest of the staff have become more efficient in searching through using the right filters to search for the right physician. And then this is the number of filters used in the search, and that's pretty much average. And as preferences are expanding, we've noticed that the number of filters that we're using, there's more and more filters to get really right to the right physician in the right location at the right time. So I'm very excited to share the results today of the changes that were made and how that impacted us in Physician Referral Service. So key improvements since engaging with the vendor solution have been improved consumer-patient experience, because it's just easier for the staff to be utilizing the tool. So the whole experience from the inquiry through the conversation right to the matched physician has just been more pleasant. We've had very good feedback on that. We have increased accuracy for referral matching, which I will share in a later slide, increased utilization of HSS and physician capacity, improved data tracking, much more robust data reporting. We have the ability for immediate and actionable decision-making metrics to make changes. Ability to integrate with other hospital EMR systems really helps us track conversions. And the physician engagement has really improved, which helps to improve patient access as well. So we circled back to that very first survey, our criteria for success, and we resurveyed the same staff to now look at the new solution and rank it again on a scale from 1 to 10. And as you can see, where we were pushing 5 and 6 at most, for the most part, we were more in the red than anywhere else. With the new solution, we were at between an 8 and a 10 in every area, even in areas that were not part of the legacy system. And so we were very, very happy with the feedback we got from our internal stakeholders and the users in Physician Referral Service. So one of the biggest improvements, speaking about referral accuracy, was we increased referrals to our non-operative physicians, where originally it was 41% in total were sent to non-operative physicians. This increased to 54%. And what we had heard from our surgeons in the legacy system was that we were referring patients to them who had not been quite ready for surgery, and that they needed an evaluation prior to a surgical consult, and they wanted us to make sure that we really set up the system that our surgeons and our non-surgical doctors were separated appropriately so that the referrals would go to the right physicians. And so that was a very big win for us when we saw the shift in the referrals. Some other results, looking back at the four criteria, so for enhanced patient experience, what we were able to do was increase productivity with the same number of staff. And this allowed Physician Referral Service to manage an increased call and email volume, which resulted in us being able to manage more patients in real time. So the queues were less on our phones. More patients were managed each day. We were getting information into the hands of patients as fast as possible, allowing them to move forward with their care. And so with the same number of staff, we were able to manage overall, we increased referral volume by 15%. And this came through a call volume increase of 27%, 42% increase in email volume, and we also were able to manage 19% more physician profiles than before. And with new physicians coming on board and managing their profiles with the same number of staff, that also provided access for our patients. Looking at physician and leadership engagement, we have 95% of physician participation in Physician Referral Service. We're providing 24/7 data analytics dashboards to over 200 physicians and their office staff, including service line directors, physician practice management, our marketing team, and HSS leadership all have access to analytics data for referrals. The new system allows for more efficiency. It's user-friendly with our improved workflows. There was a 17% decrease in handle time, which created the capacity to answer thousands of more calls and email requests. The training time from new staff reduced from 2 weeks to 2 days on the new system. The staff enjoys using the new system, which makes them enjoy their conversations with the patients more. Our integration with multiple systems also allowed one of our full-time employees who used to spend a half a day per week maintaining our legacy system was now spent towards answering phones and emails that allows that representative to manage hundreds of additional referrals per year in the same time that we used to just maintain the legacy system. So these promising results allowed for new initiatives to be operationalized and managed through Physician Referral Service. That being our spine triage, our knee pain center, our ankle fracture program, and our direct access to physical therapy. And this results in faster access to appointments, higher conversion to appointments, and improved outcomes for our referred patients. And I'm just going to share with you our lessons learned through the process. So when we looked back at the process in implementing the new system and what we needed and looking at the lessons learned, what we realized is that the extensive time we spent during the discovery phase to define the problem and agree upon the scope of the project, such as the referral matching, the CRM tool, the tracking the analytics, really allowed for the smooth build and implementation. So I highly recommend spending a ton of time during the discovery phase outlining what is needed. It's very important to include internal stakeholders very early in the process, even before you're fully outlined with your goals, so that mutual goals can be considered when bringing on a platform that's going to affect multidisciplinary departments. And we wanted to make sure that everybody's goals were aligned. We also spent a lot of time developing our physician scopes of practice, and that was looking back at 2 years of historical data for each of our service lines, looking at the conditions that were and treatments that were referred to physicians in that service line, and taking it to the service chiefs to get their buy-in that scope of practice seemed like it was fully robust for each of their service lines. And that took time to get to the service chiefs and to have their time and oversight. We also had a very systematic communication plan to encourage physicians to update their scope of practice and to be part of the Physician Referral Service panel, showing the value that was going to come from the referrals that we were providing. And this communication plan was multi-tiered. It took a lot of time. It started with our surgeon-in-chief, who helped us communicate to the physician chiefs who helped us communicate to physicians. And then we sought out added support from our physician practice management team and the office managers to remind the physicians to fill out their scopes of practice, and this allowed for the 95% participation rate. It was also important to identify physician champions along the way, as well as key practice managers to bring the other office managers on board. We also provided a system demo to our physician referral staff prior to finalizing the implementation, asking for their feedback, talking about the process, and so we could still tweak the flow of the system in that moment, and the physician referral service staff felt like they had a part of the build in the system as well. On the day that we were rolling out the system, having the vendor on site with enough support to train the staff during the rollout phase was very important, and I'm happy to say that we had many vendor support staff there, and we really did not need them because of the time we spent leading into the rollout of the system. Once the system was up and running, we immediately took demos to all of our physicians. We went to business meetings. We presented in main physician seminars and really made it transparent that this was the system, and on an ongoing basis offer our services to meet with physicians and to show them in real time how the referral rotation works through pure randomized selection, again helping them to build trust and see the value in the physician referral service process. And then providing them with transparent data and analytics is what was needed to really help the physicians understand what physician referral service was doing, and with the goal of providing access to our patients. Because what we found is getting patients to the right physician the first time allows for them to get that appointment fast, which provides a better outcome for our patients, and that was our goal. Thank you.
Thank you, Andy, for that presentation, and I want to remind folks where to go find this presentation and other great Davies use case recordings, and that information can be found at the HIMSS Davies Award website at hims.org/Davies. And you can also find information on how to apply for Davies Award. Again, that information can be found at the HIMSS website at hims.org/Davies. Thank you very much.
Hey, Arnold.